So women specifically need to ask their doctor, I also would like you to screen me for a range of sexually transmitted infections. Do you have to be specific about which ones they should look for?
Gonorrhea and chlamydia, that's a swab. Others are often blood tests.
And let me ask you, are chlamydia, you're often asymptomatic.
Right.
What about gonorrhea?
I'll let Kate take this one.
Gonorrhea is often asymptomatic too, primarily in women. Men are far more likely to have symptoms for gonorrhea than women are.
And men's symptoms are often burning with urination, is that right?
Yeah.
But women often do not get that symptom.
Often don't have that symptom, yes.
And I would also guess that if men are more aware of it, they will go to a doctor because they're uncomfortable, they're feeling this burning. And I would imagine too that sometimes men might not even report this to their partners, that they have, especially if it's someone that they're not seeing anymore possibly.
Right.
So do doctors or does Planned Parenthood encourage, once this is diagnosed, encourage people to go back and talk to their sexual partners?
They're actually tracked through this, the Ohio Department of Health, and we track to make sure that partners are being treated. If they're not being treated, someone from ODH it is possible for them to go out and talk to partners if we have a name or an address or something. It's a very serious infection. You know, we want to get treated. We want to make sure that the rates don't rise, that that people don't continue to give it to other people within the community. But most of our patients, if not all of our patients, usually bring their partners in.
We should mention, when we talked about chlamydia a minute ago, we didn't mention that chlamydia can lead to pelvic inflammatory disease, which is essentially what the scarring of the fallopian tubes is. So people might think that chlamydia is separate from pelvic inflammatory disease, but it actually leads to it. So I just wanted to clear that up.
I'd like to have Kate talk about, when she talks about her STDs in her classes, she has a fun game that gets the kids engaged. I love this part that you do.
Oh, tell us about that.
We do an activity where I make them be sexually transmitted infections, where they have to wear like little signs that say gonorrhea or chlamydia or herpes, and then they're that sexually transmitted infection for the whole duration of the game. And we have different signs, like one would be transfers through body fluid or transmits by skin-to-skin contact, and you have to go over to your sign. But I have the rest of the kids, if they don't have a sign, they're my detectives, and they can call people out if they say, oh no, herpes is in the wrong spot. Herpes transmits through skin-to-skin contact. Then they get to be herpes and go over.
I wasn't sure about this at first, but Kate
Yeah.
said, she came back and was like, I want to be gonorrhea. Can I be herpes?
They were so funny. They were so excited to play it.
And they learned.
And they did, the health class that I did that, and the teacher said the kids did very well on their test on sexually transmitted infections because it's so physical. And
that is fabulous. Because I would bet you that most adults couldn't tell you skin to skin or sexually transmitted, or that is
so much fun.
That is brilliant. I've even had medical students who, when we're discussing gonorrhea, and there was one case, they go over patient cases, where a patient had gonorrhea in their throat.
Yes.
And they're all going, how is that possible? Yes. And I had to point out to a medical student because of oral sex. And this is something that didn't even occur to medical students.
Great point.
And we should talk about this because a lot of students think, and we're talking about young students here, even middle schoolers, who think that if they're not having sexual intercourse, they're protected. Oral sex is safe.
Right.
Please speak to that. This
is actually one of Kate's favorite topics to discuss.
It's not safe. And the reality is that you can get a number of sexually transmitted infections through oral sex. And you're right, a lot of students operate under the assumption, and not even just young people and students, adults too, that oral sex is the safe alternative.
Or anal sex is safe, as long as they're not having a risk of getting pregnant.
Yeah, that it's safe. And the reality is that's just really not the case, and you can get a whole bunch of sexually transmitted infections.
Let's talk briefly about HIV, and then I want to talk about teen pregnancy. But let's talk about HIV first. How do you talk to students about HIV?
HIV is my favorite topic to talk about with students because I don't think you can get enough information on HIV. It's such an important infection to learn about. It's an important infection for, I think, everyone to be tested for. I try to make the discussion on HIV lighthearted in some ways and very serious in some ways. We just try to do activities to engage them, to get them to understand the concepts of HIV. And then we go through it step by step. What is HIV? What is AIDS? What does this do to your body? How does it transmit?
And I have to say that HIV is something, I like the way you started out. Everyone should be tested for HIV because there's such stigma. I mean, you even feel like being tested, you're stigmatized just in
Absolutely.
asking for the test.
Right.
Absolutely.
So this is, I would think this is a very serious problem. We, I don't know, how well have we done on HIV rates in the U.S.? Are they going down? I think in some populations they're going down, in others they're not.
I think you're right. I
My
think
under-
the heterosexual community, it's increasing.
Especially in women.
And not-
Heterosexual women are getting HIV faster than any other group.
And it's become more of a women's disease internationally, from what I understand,
Absolutely.
especially in Africa.
Right.
It is a disease of women and children.
Right.
Because it's much more easily transmitted male to female. It's much more easy for women to get it because we have all these exposed mucous membranes in the
Absolutely.
vagina, whereas it's much harder for men to get. And that's one reason it showed up in the gay community first,
Right.
because they were practicing anal intercourse, and in the
Absolutely.
anus you have the mucous
Right.
membranes. So that's the reason that it showed up first in the gay community in the U.S.
And I think the gay community did a great job when this epidemic came about, educating the population, letting them know about safe sex practices and that condoms need to be used. And it's really, I think it's decreased in that community where heterosexuals like, well, that's a gay disease. It's not. It's a
And it's actually rising now in the heterosexual community.
And we need to keep educating.
Right.
We need to not pretend that HIV doesn't exist anymore. We need to not ignore the fact that HIV is out there. We need to do more education. I think everybody should be talking about HIV. Everybody should feel comfortable getting tested for HIV. And people who are positive should feel comfortable getting treatment for HIV.
And I should also add that when you have a new sexual partner, that you should discuss it with a sexual partner,
Absolutely.
and each of you should be tested before you have unprotected intercourse. And it's, you know, it's very important that people just talk about this openly. It's an illness like any other illness, and it's an illness you want to protect yourself from.
And,
Exactly.
and I always talk to students about that whenever I'm doing a presentation on HIV or STIs, talking about, you know, you really need to talk to your partner about this. Have you been tested?
Right.
Have I been tested?
it opens those lines of communication.
It really does. It really does.
If anything, it makes for more intimacy in a
Right.
relationship, I would think.
Absolutely.
Let's talk about teen pregnancy, because this is we have among the highest teen pregnancy rates in the world, in the developed world.
Right.
It is certainly compared to Western European countries. So let's talk about what Planned Parenthood does in terms of trying to prevent teen pregnancy.
We see women of all ages for contraception. I think that's an important thing to put out there. Whether you're 16 or whether you're 66 and in still need of contraception, we're going to see you for that. Planned Parenthood, we're lucky enough to work on a sliding fee scale in many of our sites, so it's based on income, based on household income. We do see minors confidentially. We do encourage parents to be involved with their minors, though. That's definitely not something that we want to pull apart a family with. You know, we want, does your mom know? Can you talk to her about this? How about your dad? And then making sure that the form of birth control that the minor woman uses fits into her lifestyle.
And let me interrupt you for a minute, because I would imagine, Kate, that when you talk to schools about this, you encourage children to talk to their parents about sex,
absolutely.
to talk to them about birth control.
Absolutely.
So you really work on both
Yeah.
ends,
Right.
that you're telling the parents that you're encouraging children to
Right.
talk to them, and that you really
Sure.
are encouraging the children.
We are, and I always do anonymous questions in all of my classes because I think it really encourages kids to ask questions that maybe otherwise they wouldn't ask. And two questions that I get more than any other are, when is the right time to have sex, and when is the right time to start dating? And when I answer that question, I always say to them, if this is something you're considering, you really need to talk to a parent about this, an adult that you trust, to help you figure out these things, because these are really big decisions. So yes, we definitely talk to students, talk to young people about how important that connection is with your parent and how important it is to talk to them.